the primary endpoint of the confirmed trial was verified hepatorenal syndrome reversal, which is defined as renal function improvement, the avoidance of renal replacement therapy, and short-term survival. 29.1% of patients treated with Terlipressin, compared with 15.8% of patients receiving placebo, achieved this endpoint, with a statistically significant p-value of 0.012. To achieve verified hepatorenal syndrome reversal, patients had to have 2 consecutive creatinine values of less than 1.5 milligrams per deciliter, at least 2 hours apart, while on treatment by day 14 or prior to hospital discharge. And to be included in the primary efficacy endpoint analysis, patients had to be alive and without intervening renal replacement therapy, for example, dialysis, at least 10 days after achieving verified HRS reversal. In confirmed Terlipressin-treated subjects also achieved 3 out of 4 of the pre-specified secondary endpoints.
So the Curry was a post-hoc analysis of the current confirmed trial, as you mentioned before. And really the importance of this is really focusing on the appropriate patient population. So you mentioned in your question the label-specific population. So with this large data set, as Peter mentioned before, 300 patients, it allows us to be able to categorize the different patient subgroups into 2. So we divided the groups in the on-label specific population, and we compared that with those that were not. And the primary definition, they had to meet 3 different criteria. And the first criteria is that they had to have a ACLF between 0 and 2. So ACLF stands for acute on chronic liver failure. And then they also had to have serum creatinine levels under 5 milligrams per deciliter. In addition to that, they had to have a MELD score of less than 35 if listed for liver transplant. So MELD stands for Model for End-Stage Liver Disease. And so what we found here was that patients in the on-label label-specific population, the rates of HRS reversal was higher, so 44.7% compared to 19.4%. When we also looked at the proportion of patients that were alive without requiring renal replacement therapy, that was also higher at day 30 for Terlipressin at 77.8% versus 61.3%. So really these findings emphasize the importance of identifying patients that are appropriate for Terlipressin to allow us to maximize the benefits while reducing the potential risks of those patients being treated, and ultimately reinforces Terlipressin's role in managing those patients with hepatorenal syndrome with rapid reduction in kidney function. One of the things that we wanted to note as a limitation is with post-hoc analyses of clinical trial data, it's very valuable when it comes to allowing us to generate research questions which we could test formally in future research. So therefore, when it comes to the interpretation of results, we have to interpret those with caution, given that these analyses were not pre-specified prior to the conduct of the confirmed trial. So we actually conducted 2 separate chart review studies, one in the United Kingdom and one in the United States. So in the chart review study of patients that were diagnosed with hepatorenal syndrome, most of those patients were treated with Terlipressin. So 90% of those were treated with Terlipressin. And when we did the study in the United States, and this was prior to the approval of Terlipressin, we found that 90% of those patients were treated with midodrine and octreotide. And so that allowed us to essentially pull the data using a methodological approach. We call that indirect treatment comparison, given that there were no direct head-to-head data from clinical trials comparing terlipressin and MNO. So by doing so, it allowed us to adjust for different characteristics. So we used a technique called propensity score matching, and we matched on several factors, including baseline characteristics, as well as baseline serum creatinine levels. And after adjustment, what we did find is that patients that were treated with terlipressin had higher rates of complete response. And we define complete response as a serum creatinine level of less than or equal to 1.5. And with each of the threshold, it was based on at the end of the study. So those rates were higher compared to the MNO treated population. And then when we looked at another outcome measure called HRS reversal, defined as less than equal to 1.5 in their serum creatinine levels at any time during the observation period, we saw very consistent results. And so, for example, for those patients that achieved HRS reversal, we saw 54% of those patients on terlipressin compared to 24% on MNO. So really, the findings really focus on the importance of terlipressin as an appropriate treatment option for patients with hepatorenal syndrome. In addition to that, it also is very supportive of the controlled trial data that we saw from CONFIRM. And so by validating the work that we saw in the controlled clinical trial environment, we are also able to see similar trends in real-world settings. It's also important to note that with mitogen-octreotide, though it's currently being used frequently in the United States, the efficacy and safety of this treatment is not established. It's not approved for that indication by the US FDA. So it's also important to note that there are also limitations for this particular analysis, in that different clinical markers, such as MELD scores, such as ACLF, were not available in the UK data set. However, it was available in the US. So those specific factors we were not able to use for adjusting for some of the baseline characteristics between the two treatment groups.
So indeed, the data on terlipressin presented at DDW do confirm what we saw in the pivotal CONFIRM study. Using terlipressin according to the label is important and providing the best results. It contributes to the ongoing conversation around the efficacy and safety of terlipressin and HRS-AKI by absolutely reinforcing the clinical utility while addressing the safety concerns, both in real world and in the controlled clinical settings of a clinical study. Overall, the DDW data underscore the importance of terlipressin in the management of HRS-AKI and support its use in appropriate patients. So please do see the safety information, including the boxed warning, in the prescribing information.